Voice of Dr. Olabintan from Livingspring Family Medical Center. I'm going to be talking about something that's very dear to my heart, and that is mindsets. Mindsets for better health. I do believe that mindsets are very important. They shape how we see life. It also affects our health outcomes, and so it's very, very important for us to make sure that our mindsets are in line with better healthy outcomes. So I always like to say real quickly why we're doing the live, why this topic. And we're doing this topic because I've had people who have asked for this topic. I've seen this come up in conversation, even with my patients. And you live out how you think. That's the truth. Ultimately, we live out how we think. And so it's very important that our mindsets are in line with that which makes our health better. It's a very, very, very important topic. I believe that everyone is a few mindsets away from their breakthrough or from, getting to the next level as far as what they're supposed to do. So I think it's an important topic. So thank you so much for coming. I like your backdrop, by the way. Thank you. All right. So real quick, I always like my guests to introduce themselves because I think you do better justice, but I'm so happy to have you on. So kindly let our viewers who are watching now and those who will watch later know who you are and what you do.
Thank you so much. Thank you so much for having me, Dr. Tolu. This is super, super exciting. I'm really, really, really honored. Thank you. I'm Adam Harrison. I'm a family physician. I'm a qualified lawyer. I'm an ex-medical director, and I qualified as an executive coach last year, about a year ago. And I coach mainly doctors, some lawyers on all sorts of things, leadership, well-being and wellness. Have particular interest in kind of actually the two of those coming together, leadership and wellness. So actually making good kind of leadership through kind of a bedrock of wellness and well-being. But also I'm very interested in the kind of flip side of that, the kind of toxic cultures in organizations and the effect of that on schools. So having been bullied quite a lot as a junior doctor myself, I have a real passion for helping the victims of bullying with what I call the coachable consequences of bullying. So I mean, all the kind of your confidence is massively knocked, isn't it, when you're bullied? You really, you're put down and you're diminished and so on. So that can have a knock-on effect on all areas of your life. It can make you feel imposter syndrome, have problems with conflict, assertiveness, confidence in general, and mindset stuff as well, which we're talking about today. So I kind of help doctors kind of like rebuild that confidence that's been knocked down so that they can go on to be happier and more successful at work and in life in general.
Awesome. And I like how you took, a negative life event or a negative encounter for yourself or something has happened and you don't want people to go through that. And so you went into, a field where you can help people even come out of that on the other side better. So that's good. I want to give you that credit.
Yeah.
So I can see that I'm sure you deal with a lot of mindsets because you have to coach and, help certain, you have to help people overcome certain mindsets that may have been set in place because of the bullying or because of certain experiences in the past. So yeah. I'm very happy that you're here talking about mindset. So why do you do what you do? So you touched a little bit on that already. You have experience, but just for the sake of our viewers, can you harp on that a little bit? Why do you do what you do? Why so passionate?
Yeah, that's a great question. It's a funny one, isn't it? Because if you look at all the data on bullying, the thing that really stands out for me is that there seem to be quite low reporting rates. The quite surprisingly low. And then I kind of reflect back on my own experiences, and I had episodes that were in the double figures, and I didn't report a single episode. So it kind of makes sense to me, because there's a whole load of stigma attached to it. There's shame. You feel ashamed. You feel on your own. You feel who's gonna help me anyway? They're just gonna all kind of round up together and close me off and close ranks and so on. So you can see why people don't report it, and then I guess I just moved on in my life and tried to have a growth mindset about things and put it behind me and move forward. And then I was tutoring some Indigenous students in Australia last year.
Okay.
And one of my students. She had an experience, her first ever attachment on the wards.
Okay.
So first ever placement on a medical team with a consultant physician, and she was publicly shamed and put down by the attending.
Okay.
In front, I think there were about 11 other doctors present at the time. And I was her tutor. She reached out to me. We had a conversation. I tried to advise her as best I could, but it just brought all those feelings flooding back to me. I just thought, you know what, I've got to do my little bit to help. You know, it may be a drop in the ocean, but if I can help one person, then so be it. And so this is what I want to do. It was my epiphany, really. So.
Awesome. And I'll say this too, I'm sure you had to do some unlearning and some relearning and some mindset shifts, of course, to be able to then use your circumstances to empower other people. So I know that for those who are watching, those who will watch later, I know that the conversation is about, how to help doctors through bullying and how to coach, but I don't want people to tune out, because it's very important, to come out of something that intense, that mindset blowing, not in a good, because those things can get circumstances in your life that can make you feel really bad and feel like almost like there's no way forward, or make you feel ashamed, or really attack your self-esteem. It is possible to change your mindset, to empower yourself, even to better health, and even to other achievements you're meant to have in life. So it's not the road, and that's what I want to encourage people with this morning or afternoon, or whatever time you're watching this. All right. So my first question is this: how does one practice mindfulness? I used to think this was a very frou-frou topic before. Oh, what do you mean by mindfulness? What does that even mean? But I've grown to understand that you're a product of your thoughts, and so it's very, very important to master, at least try to master, mindfulness, and making sure that your mindsets actually help you do better. Okay, so how do you practice mindfulness? For those who are wondering, okay, what does this mean?
Okay, cool. Well, just to go back very, very quickly, this is, as you say, is for everyone. This is not me kind of like talking to doctors about who've been bullied. There's a lot of things in life that apply to all of our patients, where our confidence is knocked, or we put down, or gosh, in our relationships, and it may be a bullying relationship, it may be something to do with bullying, but the oppressive situations, like if we're overweight and we really want to lose weight, and someone turns around and says to us, you can't lose weight, you're never going to lose weight, you're always going to be fat, or something like, so this applies to everyone. So yeah, and mindfulness, I used to think it was a bit of an enigma to me, really, and actually there are far better people than me to explain about it. I posted on LinkedIn about the benefits of mindfulness, as you know, and my friend Darren Davidson, who's a fellow physician, I interviewed him. It's on my YouTube channel, and he gave a fantastic definition and explanation. He's quite a seasoned practitioner, but really, I think the essence of mindfulness is that, firstly, it's a skill, and it's about being present in or focusing on the moment, and judgment or critique. So there are those three strands to it. It's a skill, so that means it can be learned and it can be improved. It's about being present in and focusing on the moment. So often we're in situations, with our other halves or our kids or whatever, where we're just distracted by something that happened to us an hour ago, or something that happened to us yesterday or last week, or we're worrying about something that's going to happen tomorrow or next week or whatever, and we're just not fully present in that moment. So it's about being in that moment, and then without judgment or critique. So literally, not judging yourself or judging the thoughts that are going through your head. In terms of there are other people better qualified than me to talk about. And there's a couple of types of mindfulness that I know of. Single point of focus, where you're trying to concentrate on a particular thing, and thoughts are going to come into your head because we're humans and we have tens of thousands a day, and it's about just like acknowledging them and just not judging them and letting them pass by. Or there's contemplative mindfulness, where you can actually pay some heed to those thoughts that come in, and just kind of follow them through to their logical conclusion, again, without really judging them. And these are, the contemplative one particularly is good for, working on our negative mind chatter, our critic. It's also called ANT, automatic negative thoughts.
Okay.
That's to kind of like look at it, examine it, and say, actually, that's not serving me. That thought is not serving me, and just kind of bat it away. So that's essentially, in a nutshell, mindfulness. And obviously, we know that is good for the immune system. It reduces inflammation over time. It improves the cardiovascular system. It's good for lowering your blood pressure. It's good for helping with cell aging. It's good for diabetes. It's pretty much good for anything physical in your body over a long period of time. But it's great for mental health stuff. Obviously, if it reduces that negative mind chatter, then it's good for depression. It's good for anxiety. It's good for post-traumatic stress disorder. Studies have been done on American military recruits, the Army and the Marines, and they've demonstrated that it helps improve PTSD after kind of battlefield action. Chronic pain, if they've had an injury on the battlefield, it's great for helping chronic pain improve. Good for homesickness, making them feel less homesick when they're young rookie recruits are away from home. So it's just great for so many things.
Awesome. And I wanted to highlight a few things because and sometimes I have this in conversation with patients, thinking about what you're thinking about. We're practicing mindfulness. I like the emphasis on, being in the moment. A lot of times we're worrying about what's next. We've worried about what was past. It's no longer an issue. So it's like, what's next to worry about? And so if you're not careful, I say this way, you're not living, you're just worrying. So, what has happened before you're worried about that you've overcome? Reflect on that. And then as the thoughts come in, think about, or the worries intrude, or they come in, you ask, okay, what can I do about this? And then I address it. What I can't control, I let it go.
Yeah.
Just like you say, the thoughts come, and then you think, okay, what's the natural path to having this addressed? And I'll do what and the rest, it's out of my hands. So bye. So, is very, very important. And I like that you say it's learnable. It's not something that's going to happen overnight, but there's a consciousness that one has to have about it. And I'm all about, I also encourage coaching too. It could be in the form of a paid coaching system, like one that you offer, or, if it's, even reading books on mindset shifts, or just something to improve how you think. And I think that's something should invest in. And if that's all everyone takes from this, I think that's good. All right. So my next question is, what mindsets can help improve one's mind health outcomes? So what mindsets can help improve health outcome?
You talk about so many things that I just want to latch onto and kind of talk about. I just want to say, if anyone does want to invest in a book, the godmother of growth mindset, the creator of growth mindset concept, is Professor Carol Dweck. She's a professor of psychology in Stanford, and she wrote the book Mindsets. So that is the seminal work on mindset, if people want to invest in that. And you talked about control as well. I don't want to let that go without a reference to Stephen Covey's circles of control, influence, and remoteness. And it's a bit complicated for a Facebook Live because we only have a certain amount of time. But essentially, I use this example a lot with interpersonal relationships. So when you'll be the same when you see a patient who's suffering from depression, unless it's that kind of depression that's caused by the neurochemical imbalance in the brain.
Right.
If it's caused by something else, it might be a work-related problem, might be grief or whatever. But oftentimes there's another person involved.
Okay.
It's usually an interpersonal issue that's led to the problem of depression. And I sometimes almost #joking, not joking, say to my patients, if it weren't for other people in the world, there would be a lot less depression. Yeah. So in terms of control and applying it to the interpersonal relationships, just think about what other people think, say, and do, and then what you think, say, and do. And you cannot control what other people are thinking, and you can't control what they say, and you can't control how they act and how they conduct themselves. But you can control what you think to an extent, as in you can choose not to give any credibility to the negative thoughts. You can definitely choose, the things that you say, and you can choose how you act. So be proactive and don't be reactive. You know, don't choose not to react to the negativity from another person, and choose to sort of rise above it, because that is within your control. That's within your locus of control. Anyway, sorry, that was an aside.
It was a good aside. It was a good aside.
But in terms, sorry, I think you asked about mindsets that can help improve health outcomes. Mm-hmm. I think, to put it really, really simply and in kind of, you know, everyday parlance, you know, let's just go from this place of having a can-do attitude, having a positive mental attitude, you know, because someone who's kind of like who goes from that place has that kind of self-belief, you know, I can do it, I can lose the weight, I can quit smoking, you know, I can kind of avoid the things that upset me or whatever, you know. And at the most basic way of thinking about it is just having a can-do attitude. And I think this is really a sort of layperson speak for growth mindset, essentially.
And a lot of times,
you know,
people think that that's so, oh yeah, sure, you're supposed to say that. It's actually, you have to, thinking negatively doesn't change the outcome. Like, it doesn't empower you. It actually deprives you of clarity too. So it helps to think positively. A lot of times people say, oh yeah, you know, that's not how I am. I can't, like, you know, just what if you win? What if you can? Like, what if?
Yeah.
You know, possibility too. You know?
Yeah. Exactly. It is about saying to yourself that you can do something. But Carol Dweck is very fond of the phrase "not yet." You know, so okay, I haven't been able to do something. You know, I can't do it. You know, I can't lose weight. I can't start running. You know, did you have you done one of these with Michelle Quirk, Dr. Michelle Quirk?
Yes, I have.
Yeah, I thought so.
Yeah.
Two of my favorite people were doing a session together. But yeah, so, you know, I can't run. You know, I'm not a runner. I can't run. I can't quit smoking. I just can't do it. You know?
Running is not for me.
Yeah. I've tried, and I've failed, and I can't do it. And it's like Carol Dweck would say, yeah, you can't do it yet. So there's always that kind of, you know, and the concept of failure being a learning opportunity. In my 8-year-old has a big life journal. And you know, the word fail is turned into an acronym: first attempt in learning. You know, so you've got to kind of embrace that idea, that notion that you got to keep trying. And you know, I think I heard someone use the term fail better. So just get better and better and closer to your goal, you know. But yeah, so having a growth mindset is, you know, if I fail, try again until I succeed. You know, I'm not good at this yet, but I will learn, and I will practice, and it needs effort, but I don't mind putting in that effort. I don't mind that it's challenging. I'll embrace the fact that it's a challenge. You know, as people with fixed mindsets are the opposite. You know, they don't, you know, it's like, well, I am what I am. It is what it is. You know, I can't improve myself. You know, I'm born this way. You know, it's very much kind of like that your abilities and your talents and your intelligence are all kind of fixed, and you can't improve on things.
Okay.
So
okay,
it's pretty
awesome. Adam, you've unpacked a lot, and I don't want to just brush by, so I want to emphasize it before we go to the next question. So there were a few things you said, and one of the reference I usually use, you know, is the Bible, and one of the verses is in Philippians 4. It says, whatever things are pure, whatever things are good, whatever things are noteworthy, whatever things are a good report, think on these things. So it talks about positive thinking, positive outlook on life, positivity. And there's another verse I like. It says, as a man thinketh, so is he or she. So how you think is who you are essentially over time. So it's really, really important to think good, to think positively. You mentioned that as one of the things that can help improve one's mindset. You also said, number 2, you know, even if you can't do something, the approach can be not yet. So it's possible. Not yet. Then number 3, failure doesn't mean that you're no good. It just means, okay, we'll try something else. That's it. This didn't work. I've discovered that that's not the way to go. I try something else. Okay, so those are empowering mindsets. I'm hoping that people are really listening and catching on, because a lot of people who are doing things that you feel like, oh, that's not me, or wow, they must be amazing. I'm not discrediting them. I'm sure they're amazing, but so are you. It's just a question of mindset. It's just a question of mindset. And You were already starting to answer the next question I was going to ask, which is, what are mindsets that can affect health negatively? So I'm going to
Yeah.
let you continue,
Yeah.
and you already started though, but go ahead.
So essentially, it's the flip side of the growth mindset. It's the fixed mindset. You know, either I'm good at something or I'm not. I can't learn this now. It's too late. You know, it's too late for me. You know, I'm 70. I'm overweight. I can't lose this weight. You know, I've tried to shift it. There's no point in trying if I'm going to fail. You know, I always struggle with this. You know, you're kind of making excuses for it before you've even tried. You know, as I said before, I can't make this any better. It is what it is. I've always been told that I can't do X, Y, and Z. You know, I can't lose weight or whatever. But I think some of the things that people with these fixed and negative mindsets do that can actually improve things, talking about positivity, is really positive psychology techniques.
Okay.
You know, so that these are things that they don't do, which is also why they're kind of in this. But just things that it wouldn't occur to them because of the mindset. But the mindset can be changed. It can be worked on. You're not stuck in a fixed mindset forever. Okay, please don't ever think that. But just things like and I think a big basis of this would be journaling. So having a journal and actually writing things down with pen and paper, so it goes brain onto hand to page, of every day 3 things that went well that day. You know, it just starts gradually over a period of weeks to actually change the neurochemistry, change the physiology of your brain. Over months and months, it will change the anatomy of the brain as well, but it in a positive way. You know, so to document things that went well, and it will actually make you a more positive person. Have a gratitude practice. You know, document 3 things.
I love that gratitude. It is so.
I know, and I loved a video recently on Facebook that our friend Dr. Rashmi Shram did on gratitude, and I'm going to get her on my Clubhouse club room to talk about that. But she's amazing at it. But you know, and you know, documenting things that we're grateful for, but also reflecting on them and trying to, you know, kind of live them as well. Affirmations, actually writing things down. You know, like, I am superior to negative thoughts and negative behaviors, you know, and actually kind of repeating them and reciting them. But I think more important as well, and these positive psychology techniques as well, that again, people who kind of don't have this kind of mindset and it's affecting their health adversely, don't do for themselves, which is having self-compassion and practicing self-forgiveness. You know, and these things actually, you know, being it's a bit like you know, whether you agree with this or not, you know, that adage, charity begins at home. I'm not sure I entirely agree with it, because I believe in giving, but I think forgiveness starts at home and compassion starts at home, because if you can't be forgiving and compassionate of yourself, then how can you do that for other people? It's otherwise it's hypocritical, isn't it? Because you're being compassionate and forgiving to others, but you're really, really hard on yourself. And bringing it a little bit back to doctors, we're really bad at that. We're the worst culprits at kind of like putting ourselves down and being frankly quite horrible to ourselves at times for making mistakes or something like that at work. But you know, as part of the growth mindset thing, okay, so you know, I plan to go for a run, you know, 5 days a week, and I didn't feel like it today. Don't beat yourself up, just forgive yourself. You know, you missed a run, so what? You missed one run. You know, you fell off the wagon and had a cigarette. You know, we're human, things happen, stresses come along. Don't beat yourself up about it and say, oh, that's it now, that's it, I've ruined it now. I'm going to forget the whole weight loss thing. Forget it. I'm useless. I can't do it. Just forgive yourself. Be compassionate to yourself. And that is, you know, something that people who, you know, don't practice that will have worse health outcomes, you know.
Awesome.
Does that have a question?
I want to unpack some of what you said, because you dropped a lot in the last, you know, the whole live dropped a lot, but I wanted to emphasize a few things. So mindsets that can be that can affect one's health negatively is a fixed mindset, a mindset of I cannot change. You know, I'm a testimony to the fact that, you know, people can change, and I've seen people who are introverted become extroverted when they need to be. They learned it because they opened themselves to the thought that they can do hard things and they can do different things even outside their natural tendency. So no one is fixed. Everyone has a tendency to change, but it starts with thinking that I can change. I may not be able to change right now. You give us that phrase, not yet. Maybe not right now or not yet, but I can get there. Okay, so opening your mind to possibility. You mentioned the importance of reflecting on gratitude. I use the phrase practice gratitude. And when I say this, it almost seems like, oh, good, you have things to be thankful for. No, you have to go back in time. We have a tendency to forget. Same thing in relationships. Someone has done a lot of good for you. You enjoyed the relationship. One thing they did wrong, and of course, there's a different degree of wrongness, but they don't something wrong, and it automatically erases all the years of good that they've done. We have that there are times we need to go back and reflect on past victories. I say this a lot to my patients who struggle with anxiety. What are things you were anxious about before that you're no longer anxious about because you've overcome? You're worried about starting high school. You're worried about getting married. You're worried about going to school. You're worried about, I don't know, giving a speech. You did it. But it's now nothing to worry about. You look for the next thing to worry. But take time and look back and document past victories. So you know what? I did that. That was a worry, but I overcame. So the odds are in my favor. So journaling it, writing it down, because we forget. It's a natural tendency. We forget sometimes the good things. We got to write it down. 3 things that went well every day, and that empowers. And you did mention it over time. Practice, you actually change the wiring of your brain. As a man thinketh, so is he. As a woman thinketh, so is she. So very, very important how we think. And then you talked about affirmations, confessions, speaking them out, speaking words that encourage, that uplift to yourself. Yes, it sounds frou-frou, as Dr. Una will say. It does, but it works. It works. And sometimes I think that's where it becomes a little bit challenging, a conundrum, because people feel it's supposed to be harder than that. It needs to be something really technical or so complicated, but it's as simple as writing these things down, writing positive things, even when you don't believe it. Even when you don't believe it, because over time, you start to what you think is what you say and what you live out. So tell your brain, yes, I'm this. It may not seem like it right now, but I'm getting there. Just keep telling yourself, and then soon your brain accepts, and then you live that out. You live it out. I want to make sure I'm emphasizing you live out what you're thinking. So talk to your brain. Tell it that you're capable. Tell it that you can do hard things. Tell it that your past does not necessarily reflect your future. Tell it. It will over time believe it. That's very important. And then you mentioned self-forgiveness. OMG. 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 Love others as you love yourself. You cannot love others if you don't know how to love yourself. You cannot forgive others if you don't practice. You can't forgive others well or the way you should. You don't learn self-forgiveness. It starts at home. So you made a mistake. You're sorry. You apologize. You got to forgive yourself. Say it. I forgive myself. I forgive myself. That's it. Thank you so much, man. This was heavy. What? Oh, it's 8:03. We're at 33 minutes. But this has been very, very power packed. I'm so grateful, Adam. At some point, we'll probably have you over again, and we'll discuss more mindset shifts, and maybe do something geared also for doctors, because I think, no offense to the non-doctors watching, but I think that's really important. So, Dr. Adam, where can people find you? They're like, this guy's awesome. His accent is awesome. Where can we find him? So tell them, where can we find you, Dr. Adam?
Oh, bless you, Dr. Tolu. God bless you. I hang out on LinkedIn a fair bit. That's my favorite social media platform. I'm just Dr. Adam Harrison on LinkedIn. I have a YouTube channel that I like putting stuff on. That's Dr. Adam Physician Coach. And I have a Facebook page, which is Coaching Mentoring Doctors, but lots of non-doctors are welcome. And I'm on Twitter, but I don't hardly use it. So no, that's fantastic. Can I just say that biblical phrase, treat others as you treat yourself. I reckon in this case, almost flip it around, because I think we treat others often better than we treat ourselves. So treat yourself as you treat others. And that's a great first step.
The first step, love yourself, love others. I don't teach selfishness. It's important to love others and be giving and be kind, but it's also good to do that to yourself.
Absolutely. 100%.
Yes, yes. This is good. Thank you so much, Adam. All right. Let me not get too carried away. Thank you all for watching. For those who are watching live, thank you for watching. For those who will watch in replay, please do #replay and let us know what resonated most with you. And if you know anyone who could benefit from this, please share with them. I believe this is shareable, so go ahead and forward it to those who you think this will encourage. And if you or anyone you know is looking for a family physician in the Mansfield, Texas area who is thorough, who is passionate, and who is caring, I am she. Thank you, Adam. Awesome. I'll talk to you later, okay?